Kamal is speaking there. Okay. Cassia Rachel.
Sir, I don't know the answer.
Okay. Lakshmi,
Yes, sir.
what do you think these disadvantaged patients are?
So some patients may have difficulty in asking doubts,
Oh, like you,
queries.
right?
Yes.
Okay. No, that is not the thing. Okay, let us move on to Manoj. Manoj,
Yes, sir.
yeah. Who are these disadvantaged patients? What do you think?
Maybe people with disability or something.
Disability, yeah, that is also correct. Those who are socially, economically poor, number one. Those who have a disability, correct. Any other patients, can you, do you think, apart from these two?
Sir, depressed patient like mental problem.
Mental problem. But they will come for the treatment and they get the treatment. Depression can be treated, correct? They are the normal patients. These are called as disadvantaged patient due to study. Marlin, Sarah.
Yes, sir. Sir, I don't know that.
Okay. Mega,
No, sir, I don't know.
Navindran.
Sir, maybe those patients require more care.
Okay. Due to what reason? Any guess?
Because of disadvantage.
Uh, yeah, you mean disability patients
These
who needs
records,
care.
these records will be very useful, no?
Which one?
These records will be very useful for those
No,
patients.
yeah, that is why we are trying to list out. There are one more type of patients which I am looking at it. These two are correct, what you told, and also your
Okay.
classmates. Other one,
I don't know,
Nikita,
sir.
Nikita.
Sir, who have multiple disorders.
That
Like,
they are also normal patients only.
don't know, sir.
Ria Pillai,
Sir, those patients who are at a high risk of developing various diseases.
who are at
High risk of developing other diseases. Many diseases.
high risk of many diseases, huh?
Many other diseases.
Many other diseases. No, but they are not become. They are only a risk patients,
Okay.
but they are not actual disadvantaged patients. No, disadvantage is yet to happen.
Okay.
Nikita,
So,
what do you think?
sir, I just told before, yeah.
Oh, okay. No problem. Then who else is pending now? To Ria, Sarah.
Yes, sir. So those patients who may die due to the like while the data is being collected.
Oh my God. Okay. So since data is forcefully collected, they died, right?
No, sir. Like if there's any previous history of diseases,
Okay.
while collecting the data, the patient may die, and that gives an
No,
incorrect data.
not that kind of. Okay, no problem. Good try. Sai Srileka,
Sir, don't know, sir.
why you are so much worried to tell? I don't know. Okay. Safisha,
The lack of diagnosis data.
no. We have a data. We have we have the provision, no, to enter diagnosis. they will fit in. But there is one more group of disadvantaged patients. Okay, let us move on to other people also. Let's see. Shireen Babu.
Yes, sir.
Yes, what do you think?
Sir, illiterate people.
Oh, illiterate people. No, they are not disabled.
Sir, then if the therapy is not for proper benefit, they are not getting. If the patients, other than that, some side effect or something they are
Yes,
getting due to the
correct.
drug. And
Yeah, due to drug. Yeah, that's what the answer I was looking. The disadvantaged patients could be low socioeconomic, so they may suffer. Number one. The second one is the disability, patient with disability. And the third type is that these patients are suffering from adverse reactions due to drug. Okay, so this kind of a provision helps the what you say study in order to confirm that how many people are getting suffered due to adverse reactions who are taken the drug, right? So that is one more. Otherwise, it becomes very difficult to understand overall disadvantaged patients what treatment or adjacent treatment have been given. So you do not know. So that will become a kind of confounding factor. In order to eliminate that, this data is required. Next one, there should be a separate database for emergency care, mental health care, elderly care, mortality data, maternal child records, police accident records. You cannot fit one database to collect all information. It is not.
Hello, sir.
Yeah.
Sir, the PPT is not clear, sir.
Is it? Okay. Is it okay now? What is happening? How do you see this PPT? Some color
Now
is coming.
it's like in white. Something is come.
One second.
Now it is clear, sir.
Now it is clear? Okay.
Yes, sir.
Yeah. If there is any such kind of problem, please anybody can open up the mouth and say, so that I don't know what is the picture on your side. Please ask like the way you have asked. Okay, I appreciate it. Okay, now why there should be a different database or separate database for different departments or different records? We try to understand that. Sonam, why do you think that we
Yes, sir.
need different records for different departments or different set of patients?
So to make the database more organized, and if they want to refer for future references, it can save a lot of time.
Yes, that's correct. So you can organize the data depending on the department and depending on the type of patients, which who are who are recruited during the study. Right? Now, is it clear now? Can we move on to the next slide? Can we move on? Anybody has any doubt?
No doubt, sir.
Okay. So we have two more provisions. Database records must be accessible to patients. Why we need this records to be accessible to patients? Let us understand from Tenzin. Yes, Tenzin, tell me, Tenzin. Why this record should be accessible to patients?
Don't know, sir.
Okay. Let us move on to Amal. Amal, what do you think the reason the record should be accessible to patients?
Don't know, sir.
And Maria?
Maybe the patients can assess their own situation and give proper care.
Yes. So usually if it is accessible to the patient, they can check their own data and see the progress of their own disease so that they can take care of themselves sitting in remote place. For example, I told you in Western countries especially, there is a called as town side, village side type of places where a patient who is sitting in village can able to see his data sitting in home and take care himself appropriately. Otherwise, it becomes very difficult for him to travel all along the length to metro cities for attending the hospital, for his checkups and all those things. And also, if it is accessible, suppose let us assume that if patient loses the data, say hospital data, for example, database, the record which have been given to him. Suppose if he loses also, the information is always available in the database to check and go for purchasing of the medicines and any other related problems. So because of this, all database records, at least patient related database records, must be accessible to patients. Right. Next one is there should be a provision for assessing the patient compliance. Why it is so important? Let us understand from Aparna.
In order to assess whether the patient is adhered to the medication and whether their condition is improved.
Correct. Very right answer. So one can know whether the patient is adherent to the medicines, so that the patient condition, whether it is improving or declining. If there is a declining, there may be a medication related problems. In order to understand all these aspects, there should be a provision in the database to assess the patient compliance. So these are the ideal characteristics of an automated database. Okay, but of course the database may not have all these parameters to say that it is ideal database, but ideally what is expected from a database is this much of information, right? So can we move on to the next types of database if nobody has a doubt?
Yes,
Yes,
sir.
sir.
Yeah.
Yes, sir.
Types of databases we have, usually the countries which use database across the world are basically focused on claims database, administrative database, medical record database. These are the databases which are mainly used in various Western countries. Especially these are used in America as well as in Europe countries. But in India also it is available, but it is restricted to some kind of limited lump sum, some kind of provision to collect the data. But in insurance company, medical insurance company, the database is used in order to get the information. So as of today, but in Europe and American countries, for every system they have the record of the database. Right? Now let us understand what is each one and what is the how they function. Right? First one is claims database. Now let us understand what is claim database. Claim means like to get the money, right? To get the money or to reimburse the money. This database is used to reimburse for patients' use of the healthcare system. So this database helps to reimburse the money, especially by the insurance company for the patients who have undergone hospitalization and received healthcare treatment. So that is called as claims database. Now, how does it work? How the channel is going to be established and how the records will be generated to assess it. Patient, we will have a, always we will have a, one second. Okay. Now we'll have a patient. Now, patient, when we say their patients can be patients who are visiting the hospital, or who are visiting the pharmacy, will be of two types. One is, one second. Okay. So there will be of two types: outpatient, inpatient. So we know that patient visits pharmacy shop. He may be outpatient or maybe inpatient. The same patient will also visit the hospital, and patient also visit as our physician. I mean, visits physician clinic as an outpatient only. So in all these three cases, after the treatment or after receiving the medicines, so the bill will be given. The bill will be given from pharmacy shop for having purchased medicines, which contain all the details such as brand name, quantity, strength, price, expiry date, you know, all the data and tax, everything will be there. Even hospital, after hospitalization, you will get the bills. And clinic also, they will give them prescription. Prescription also will be associated with the what is the charge done by the physician. Especially in India, nothing is happening. They simply collect the money directly. But in abroad country, they are supposed to give the bill for having seen the physician. It is called as physician charges. Physician charge and prescription charge they have to, and diagnosis charge they have to give. In all the cases, what happens? These bills will be submitted to insurance company, in which patient has medical insurance. In which patient has medical insurance. Got it. Now, once it is submitted insurance company will have a claims, what is known as claims database. Now all the data will be fed into this claims database in order to assess how much money needs to be given. Simply they don't give the money, especially in Western countries. the money cost in dollars, whose value is very high. So they exactly calculate at every step and they reimburse the money. In all, say pharmacy, they directly sell the medicine. The medicine's cost is directly proportional to the pharmacy shop in which manufacturer price is quoted. Whereas in the hospital, as well as in physician, the bills are assessed thoroughly. First, it will start from whether hospital has used ICD, International Classification of Diseases, 9%, 10th A modified version for diagnosis. Whether they have used this criteria for diagnosis, they will check first. That means majority of the problem is taken care of. There is no confusion in the diagnosis of the patient. Once they have diagnosed using the standard criteria, then they check which guidelines they have used, which is specific to country, that particular country, to prescribe the medicines. Then when the patient is taken the medicine, how long the patient was there in the hospital before he went to home. That means hospitalization period. All these things will be assessed properly, then the reimbursement will be done. So this is about the claims database, where everything will be assessed based on these parameters, which is directly the same. Okay. Is it clear? Can we move on to the second type of database?
Yes, sir.
Next type of database is called as administrative database. What is this database? This database is similar to claims database. It is similar to claims database. That means the flow of all the bills which you have seen, it remains the same thing. But in this case, the flow of the information will not take place like that. But instead, the data is directly collected from the health maintenance organization or healthcare organization of a particular country. So the government will maintain the data of the patients who are visiting the hospital. And in USA, there are hospitals which comes under the purview of health maintenance organizations or healthcare organization. They control the data. So once the data is generated there, these organizations will have the data. So a insurance company which is having a claims database will get the data from these organizations to reimburse, provided the patient would have visited that hospital that come under the purview of these organizations. Got it? So otherwise, it also works, calculates the reimbursement amount exactly the way the claims database does it, right? So that's about this, administrative database. Let us ask, let us understand what we understand about its use. Aquina, why we need claims database or administrative type of database? Atira James.
Sir, because the amount might be very huge and the patient might not be able to afford it.
Okay, that is one thing. The second possibility.
I don't know, sir.
Yeah, one thing is that at the time of treatment, patient cannot afford it. So by using this insurance, they can get the money and the pay. That's correct. Another chance what may go wrong. Aquina. Benjin.
Yes, sir.
Yeah, what may be the reason you think?
No idea, sir.
Okay, Irene.
Yes, sir.
Ah,
Sir, sir, the administrative database that can be used to, understand the quality of care that have been given to the patients.
so that
To know that.
Yeah, correct. Unnecessary reimbursement will not happen.
Yeah.
So they will give the money or reimburse the money only for the quality service, healthcare service. For these two purposes, it is going to be used, right? Okay. If there is no doubt, we are going to delink in another few seconds, right? So you don't have to link back.